This is the first lecture, cellular adaptation. Bismillah, let's start. Okay. So, pathology means it's a study of disease. Okay, it is a study of suffering. Here, suffering means disease. So, the person who founded the pathology is Rudolf Virchow. He is called as father of modern pathology. Okay. So pathogenesis means it is nothing but it's a mechanism of disease. It is a mechanism of disease. Etiology means it is a cause of the disease. Okay, what make them to get the disease. Okay. So in pathology we will be studying in detail about the cause and the mechanism of the disease and what are the investigation to be done to identify the disease. Okay. These are the main core objectives in studying the pathology. Okay, then only you will know why the person is getting the signs and symptoms. Okay, the first concept what we are going to discuss here is homeostasis. Homeostasis means tissue homeostasis. Okay, so homeo means same, stasis means stable. In other words, the simple concept here is everything in balance. Okay, everything is in balance. For example, if you take a tissue, the cells die and the new cells come. So this is the balance in the tissue. That's why the tissue retains its shape, function, everything. If this balance get lost, they become imbalanced. If the balance get lost, for example, the cell is dying, the new cell is not coming. It will lead to Alzheimer disease. It is a neurodegenerative disease. If the cell is not dying, only the new cells are coming. Okay, there is no cell death. It leads to cancer. It leads to cancer. So when the cell goes for a stress, for example, if a person is smoking, the cell is going for a stress, and first step they do is they will try to withstand the stress by changing some kind of feature. Okay, they are adapting to a new environment with stress, and they will try to change something and they will try to withstand the stress. If the person is still continues smoking, after this the cell will go for damage. Okay, whether the damage may be cell death or it can become like a cancer. It can become like a cancer. If the person stops after the damage, okay, then it cannot be come back. Okay, it cannot come back to normal. But if the person stops here, it can come back to normal. Okay, it can come back to normal. So the adaptations are reversible. Understand? The adaptations are reversible. So cellular adaptations can be seen in physiological condition as well as in pathological condition. Okay, so there are 4 types of adaptation: hypertrophy, hyperplasia, atrophy and metaplasia. If the cell adaptation is exceeded, then the cell go for cell injury. Remember, all cellular adaptations are reversible. Okay. So I told the adaptation can happen in physiological state as well as pathological state. Because for example, if the woman is going for pregnancy, okay, the uterus becomes big. So this is a cellular adaptation. Then after the delivery, it comes back to normal. It is physiological adaptation. If the person is having hypertension, then the heart muscle goes for hypertrophy. That is pathological adaptation. In simple words, if any disease which makes them to go for adaptation, that is called pathological adaptation. Hypertrophy means it is increase in size of the cell which results in increase in size of the organ. Okay, remember, if there is due to hormone, okay, hypertrophy along with hyperplasia it happens. Okay, example, in pregnancy, the smooth muscle is stimulated by the estrogen, it goes for smooth muscle hypertrophy and smooth muscle hyperplasia. Okay, and if it is due to some pathological reason like hypertension or valve disease, they will go for, heart goes for enlargement, that is cellular hypertrophy, that is cardiac hypertrophy. Understand? So it is a pathological hypertrophy, pathological hypertrophy. So let's see some examples of physiological hypertrophy. Understand? So physiological hypertrophy happens in pregnancy. This is the normal uterus, this is after delivery, this is after delivery. So you can see the muscle is becoming very big, so that is due to smooth muscle hypertrophy. So next, this is hypertrophy during exercise, it is physiological. You can see the increased size of the muscle after exercise, before exercise it is small. So now coming to the pathological hypertrophy, this is cardiac muscle going for hypertrophy in valve disease or in hypertension. Okay. This is the normal size of the left ventricle, and this is the normal size of the left ventricular muscle here. You can see the left ventricular muscle thickness is increased. Hyperplasia means it is an increase in number of cells. Hyperplasia means it is an increase in the number of cells. It may be physiological and pathological. In physiological hyperplasia, we have two types. One is hormonal hyperplasia. Example, during puberty, the female breast becomes more number of cells, the proliferation of the glandular epithelium, as well as during pregnancy and lactation. Okay, so these are all hormonal hyperplasia. Compensatory hyperplasia means if you cut some organ, the organ grows back. Example, liver. The hyperplasia occurs when a portion of the tissue is removed or diseased. Example, the best example is liver. Okay. The pathological hyperplasia, example, stress or in a smoker, the oral mucosa goes for hyperplastic change. So these are some example. If estrogen is given, the endometrium goes for hyperplasia. So this is the fleshy endometrium. So this is the hyperplasia happens in the thyroid gland. See, the thyroid gland goes for hyperplasia. So now coming to the atrophy. Atrophy means shrinkage in the size of the cell by the loss of cell substance. So the characteristic feature is decrease in the size of the cell. It is called atrophy. So it may be happen physiological state as well as pathological state. Okay. So if there is no hormone, the organ will go for atrophy. Example, menopause. Menopause, the endometrium goes for atrophy. Likewise, in the old age, the testis goes for atrophy. So the disuse atrophy means, for example, if the person is hospitalized, he is not moving, so then the leg, all the limbs will go for atrophy. Especially the old age, if the atrophy happens, it is called senile atrophy. It is called, senile means old, senile atrophy. Okay. So denervation atrophy means in a spinal cord injury, the leg goes for example, if the lumbar spinal cord is damaged, the lower part of the body goes for atrophy due to the nerve supply, the cut of the nerve supply. So these are some example. If the person uses corticosteroid drug, the adrenal gland goes for atrophy, and this is the example for senile atrophy. It is example for senile atrophy, and this is the young brain, and you can see the old aged brain. This is small in size because of the aging related atrophy. So this is the normal kidney. Due to some disease, the kidney goes for atrophy. So now coming to the metaplasia. Metaplasia is a reversible change because it is adaptation. It is a reversible change. Change from one adult cell type to another cell type. It is replaced by the another cell type. That is called metaplasia. So there are three types of metaplasia. The two types are very important. One is squamous metaplasia. Here the columnar or pseudo-stratified columnar epithelium is replaced by the stratified squamous epithelium. It can happen anywhere. Example, bronchial region in the smoking. And glandular metaplasia, squamous epithelium is replaced by the glandular epithelium or columnar epithelium. Example, gastroesophageal reflux disease, otherwise called as Barrett's esophagus. Okay. So this is the metaplasia. This is the respiratory epithelium. It is becoming like a squamous epithelium, and it is called squamous metaplasia. So this is the gastroesophageal reflux disease. This is the squamous epithelium of the esophagus, and it is becoming like a columnar or glandular epithelium. It is called glandular or columnar metaplasia. Columnar metaplasia. So now coming to the intracellular accumulation. Intracellular accumulation is also a cellular adaptation, and it is reversible. Okay. So fatty change. Fatty change, that is increased fat accumulation within the parenchymal cell, most commonly happens in the liver. It is called steatosis. It is called steatosis. It can happen in any organ. Most commonly it happens in the liver. Most commonly it happens in the liver. Okay. So what causes them to store more fat? Because of the alcohol, diabetic, obesity. These are the three conditions which leads to fat accumulation. Okay. So when the person stop drinking alcohol, it will come back to normal. It will come back to normal because it is a reversible change. So this is the normal liver, and when it becomes fatty liver, they will become large and it will become dull in color, light color. Okay. So this is the normal liver cells, hepatocytes. Because of fat accumulation, you can see bubble inside the cytoplasm. It is nothing but fat. So now coming to the pigments. The pigments can come deposited into the cell, into the organ from outside, or the pigments are formed inside. If it is from the outside, we call it as exogenous pigment. If it is from the body, it is called endogenous pigment. Example, the dust, the coal, the carbon pigment gets into the lung. That is called anthracosis, and if it is more severe in the coal workers, in the coal mine workers, it is called coal workers pneumoconiosis. Next pigment is lipofuscin pigment. Lipofuscin pigment is a wear and tear pigment. It is, if it gets accumulated in the process of aging, they will go for atrophy. It is called brown atrophy, and they call this pigment as a brown pigment. Next is melanin pigment. Next is melanin pigment. This melanin pigment is produced by the melanocyte, and which is in the epidermis, and it gives protection against the ultraviolet radiation. And hemosiderin is a pigment derived from the hemoglobin. It is derived from the hemoglobin, and if it gets over in the organ, it is called hemosiderosis. If the hemosiderin pigment is deposited more in the organ and it is called systemic overload, it is called hemosiderosis. Now coming to the calcification. So if the calcium gets deposited in the tissue, it is called calcification. Mainly it will be of calcium, and it can contain some other salts, some other cations, but mainly it gets deposited is the calcium. And if the calcium gets deposited, it is not normal, it is pathological. So we call it as a pathological calcification. There are two types, one is dystrophic, other one is metastatic. In dystrophic calcification, the calcium deposits in the dead tissue or the dying tissue, which means the necrotic tissue, the calcium gets deposited. Here the calcium serum levels will be normal. Here the calcium serum levels will be normal. Okay. For example, in the fat necrosis, calcium getting deposited, or in the caseous necrosis, the calcium gets deposited. So whereas in the metastatic calcification, the calcium deposition occurs in the normal tissue. It occurs in the normal tissue. Here the problem is in the calcium level. The calcium level is very high. It is hypercalcemia. For example, in a cancer patient, some cancer cells secrete more calcium. That will increase the blood calcium level. Then that will lead to metastatic calcification. Or sometimes there will be increased parathyroid hormone. Okay, some cancer cells, they increase parathyroid like hormone, that will increase the calcium level. And if there is bone destruction, the calcium comes more. If there is vitamin D related disorder, the calcium comes more. If the kidney goes for failure, the calcium comes more in the blood. So that is called hypercalcemia. The hypercalcemia will produce metastatic calcification, which means the calcium gets deposits in the normal tissue. Okay. So this is dystrophic calcification, the calcium getting deposited in the aorta, in the atherosclerotic region. And this is dystrophic calcification, the calcium getting deposited in the damaged wall, damaged heart wall. Due to some infection, the wall goes for some damage, so the calcium gets deposited there. So this is a tuberculosis node, this is a necrosis, caseous necrosis, the calcium gets deposited, that is dystrophic calcification. This is metastatic calcification. Here the calcium level is increased in the blood, okay, in the serum, the calcium level is increased, that then the calcium getting deposited in the kidney, it is called nephrocalcinosis. This is called nephrocalcinosis. If it is too much of calcium, again they will form a stone, it is called nephrolithiasis. Usually this metastatic calcification, they deposit in the kidney, in the gastric wall, or in the blood vessels in the lung, because of the alkaline nature of the tissue. So now coming to the cellular aging. So the cellular aging happens due to, in the aging process, there is less oxidative phosphorylation and less protein synthesis. So which, because of these two reasons, they will respond to the stress very less. Okay. So why it is happening? Because it is genetically programmed, because some cells can divide up to certain level. For example, adult fibroblast can divide maximum 50 times, and the very young fibroblast can divide 65 times. And progeria is a condition which is called premature aging. In this condition, the fibroblast stop division after 35th time. Okay, so the fibroblast can divide only for 35 times in the progeria. So the progeria patient, they will go for premature aging. So another most important thing is telomere. In the normal cell, each division, the telomere becomes small. That is called telomere shortening. So that once the telomere is completely finished, the division will stop. The division will stop. So that is the concept of telomere. And in some cells, the telomere will keep on increased because of the enzyme telomerase. So especially in the stem cells and in the cancer cells, the telomerase is more. They can bring back the telomere, so they will keep on dividing. So telomere shortening will lead, it happens in the normal cell. The telomere lengthening happens in the cancer cell. So the cell can keep on divide. So because why? Because the cancer cells has enzyme telomerase that can bring back the telomere. So another most important thing is the free radicals, if they are increased, that will shorten the life. If antioxidants are increased, that will increase the life. So if the person takes less food, less calories, they have very less free radical, so that will affect, that will show its effect on the age. So these are the most important reasons involved in the cellular aging.